everyone, welcome to Face Value. I'm Kellie Herbert, COO of Ladner Facial Plastic Surgery, and I'm joined by Julian, our Director of Non-Surgical Aesthetics.
Hi everybody, so happy to be here.
Julian is in the hot seat today. I'm going to be asking him some rapid fire questions and we'll get to see how he answers.
Feeling a little nervous, but let's go.
Are you ready, Julian? Okay. What's the wildest thing a patient has ever asked you to explain at the front desk and you had to keep a completely straight face?
Probably when I had someone say, can I pay for my surgery in cash, but in all ones? I was like, are you serious? How long do we have today?
And it was like a $40,000
Yeah,
surgery.
definitely.
Right, yeah, that was a lot of ones. Okay, what's your go-to response when someone calls and opens with, I just have a quick question?
Probably, well, I have a quick answer for you, but if you want a long answer, we can have a more in-depth conversation.
Okay, great. We can get them scheduled for an appointment.
Right?
What do you actually do internally when Dr. Ladner is running behind and a patient is in the waiting room giving you that look?
Internally, I usually offer a coffee or some water. Really want to just chat with them and say, hey, start a conversation. It was nice to meet you in person. We talked over the phone, or everyone loves a nice cup of water or a nice cup of coffee, so why not?
Yeah, why not? I do think one of the things though is we do sometimes run behind,
right?
And that's the truth. And that's because Dr. Ladner really gives his attention and care and detail to every single patient. And sometimes that's a quick interaction. And sometimes patients just need a little more time. And if you're in the waiting room and you're feeling frustrated, just think about the fact that you might be that patient at some point that needs a few extra minutes.
Yeah, and I think just keeping it calm and collected, especially in front of a patient, is always the way I go. But as soon as I turn that corner, I'm running around.
Exactly. We're totally off track, so I'm going to get back to the questions. Okay, if you had to describe working at this practice in 3 words, what would they be? And you cannot say amazing.
I would definitely say educational. I feel like I learned something new every single day. I would say interesting, because I am learning something new and something I didn't know, and I've seen the most interesting things here while being here. And I would definitely say more teamwork. I feel like we all just kind of run in one thing, so we're very team driven here, which is nice.
Love that, yeah. What's a misconception people have about your role here that quietly drives you a little crazy?
Some people do not know that we have a non-surgical side to our practice sometimes, and they just think that I am a nurse, surgical coordinator, or the front desk. So I just say whatever you want me to be.
Got it. Okay, perfect. What's the strangest thing that's happened here that we all just fully accepted as totally normal?
I would say hearing the tapping of breaking bones.
Oh, that's
definitely
a scary
strange.
one. Yeah, it's a strange one. Or I think the burning smell of flesh from the CO2 laser.
Yeah, we
do blast your face off, and it does sometimes smell.
Yeah.
Right?
Not the best.
We shouldn't say that on camera, probably. It's okay. Come see us. You have great skin like Julian. Okay. What is your actual go-to strategy for calming a patient who is spiraling before an appointment?
I would say just listening to their concerns, of course. Everyone wants to feel valid, especially with their worries and their anxiety. When a patient comes in, I feel like if they're anxious or they're nervous, you want to give them the room, and you don't want to bring your own anxious or anxiety or your nerves into that. So definitely just remaining calm, listening to them, validating them, and offering a solution.
And maybe a hug.
Yeah.
Yeah. What's something patients do that you find genuinely endearing, even if it makes more work for you?
For me, I love that patients want to see their before and afters or have access to the photos that we take in our clinic. I know it's not too much work for me to do, but I'm just like, oh, you care about your results. We care about your results, and I want them to be able to follow along with us.
I personally love it when patients bring cookies or cupcakes into the office.
The holidays.
Yeah, the holidays are really nice. People bake us all kinds of fun things. If you could trade jobs with anyone in this practice for one day, who would it be and why?
Oh, that's a good question. It would probably be, I don't know. One of our nurse injectors. I feel like I would love
You want to poke people in the face?
Yeah, I would love to, know how to do a neurotoxin or a filler, make people feel gorgeous and happy.
Yeah, I love that. Okay, well, that's all the questions we have today. Thanks for joining Julie and I, and we'll see you soon.
Bye.